Doctors of Reddit. What was your dumbest I am very smart patient experience? Story 1. I work for an optometrist, and it was the month before school started, and a woman brought in her son to have his eyes checked for the first time. Seems like a pretty reasonable thing for any parent, even if he was a little older than usual for a first eye exam. Better late than never, I guess. The mom was well-spoken and appeared fairly intelligent. Everything went as normal. The doctor examined the boy and ended up prescribing glasses. When the doctor was explaining to the mom that her son had to wear his glasses all the time since he's nearsighted and basically can't see clearly past 5 foot in front of him and will definitely need glasses for school. For some reason, this caused a switch to flip on the mom, and she spazzed out on the doctor, saying that her son doesn't need glasses and that the doctor is only saying that he does because he wants to sell glasses. She says that she only brought her son in because there was some form for school that needed to be filled out and that doctors are all con artists trying to push unnecessary medications and interventions. The doctor tried to calm her down and explain that he's only trying to help them, but that she was free to get a second opinion and gave her a copy of the kid's prescription and sent them on their way. About 4 months later, the lady is back asking for another copy of her son's prescription. Apparently, the first semester midterm results were in, and her son failed them all because he couldn't see the board in his classes and needed glasses. I didn't get glasses until 8th grade, and I've always been extremely short-sighted. For some bizarre, probably anxiety-related reason, I went above and beyond to keep it a secret so it wouldn't come out that I was defective in any way. After getting them, I did about the same academically, since I'd come up with a lot of coping strategies over the years in school, but man did I suddenly get 100 times better at sports. I remember my PE teacher being pretty shocked. Before we continue, do us a quick favor, smash that like button and subscribe to support our channel. Story 2. I just heard this one from my girlfriend's stepdad, who was a neurosurgeon. He had an OB/GYN friend who had a couple who couldn't get pregnant. Apparently, they had been raised in some religious fundamentalist cult and didn't understand how getting pregnant worked. The guy was just dancing and pouncing against her leg and making a mess on her thigh. I think this sort of thing is way more common than we think. My mother is a gynecologist and had a woman come in to talk about possible infertility. She was 18 years old and had slept with her husband a single time and didn't get pregnant, so she was upset and scared and demanded tests and all sorts of things. She had been taught nothing more than procreation to the extent that she thought every incident of doing it was one baby, and presumably, couples who had 3 kids had only done it 3 times. So my mom had to give this married woman a sex education lesson. Story 3. I am a medic. And back when the Ebola crisis was huge and the media was losing its crap over it, I had a very interesting call. There are definitely other instances, but this was at the forefront of my mind, and it makes me both laugh and cringe at the same time. We were riding 3 deep, an all-female crew dispatched to a sketchy part of town in a bad apartment complex for unknown urine problems. I said I was taking the back seat on this one and just going to observe. We're met in the ambulance by a late 50s, early 60s African-American male. Unkempt, yellow eyes, clothes that look like they'd been slept in for a week, dirty nails, and general uncleanliness. He asked us in a very thick accent where the men were. There are no men, it's just us. We all have the same training. If you're more comfortable with a man, we can get a male crew here, but they won't do anything different than we will. He said, women can't be in male positions. You should all be home taking care of your husbands and children. Sigh. One of these people. I respect and get cultural differences, but it gets old. After going back and forth for a few minutes about our training and trying to explain to him in futility that none of us were married at the time or had kids, we finally told him, look, we aren't here to discuss, we are here to help you. You called us. What made you hurt so bad that you called 911? We have to assess you. We can just get another crew over here not knowing what the problem is. What issue are you having? My package. I think I have Ebola. Cue the eye rolls. You have Ebola in your package? I said. It wasn't a question. Yes, I just came back from Liberia last week and I haven't urinated in 4 days. Cue him spewing all tons of what his culture says about illness and Ebola. His cousin, who was a doctor in Africa, told him he had it and it could be cured by getting intimate with a virgin, and he eyed all of us like we're meat. What the heck? We wound up ignoring him and continuing our assessment. He was so adamant about it, though. He cited obviously fake odds and facts and bragged he slept with several women in Liberia, and that's how he got Ebola. Okay. Are you in pain? Can we take a look? He let us get a set of vitals, but then he revealed us his package. His sacs were the size of grapefruits, and his flute was turtled to the point it was basically inverted. His bladder was palpable and swollen too. So the dude was legit. He definitely had some issues going on. He was convinced he had Ebola only in his package. Also, I am sure he was more shocked that we weren't fawning over his gross-looking privates, us being a crew of women. I should note, this dude very much did not have Ebola at all. We took him to the hospital, and when we told the receiving nurse what the chief complaint was, she brought the doctor over and asked us to tell him to his face what the patient was complaining about. When we went back to drop off another patient, we asked how patient 0 was. They laughed and said he just had some prolapsed organs in his sacs and his pelvic floor was trashed. They had to stick a catheter down his urethra to drain the pee. No Ebola, but he definitely was riddled with STDs. Story 4. I once had an 80-year-old patient who was declining with multiple diagnoses and about 3 decubitus ulcers. The daughter was adamant that her father be kept on his strict paleo diet because that would supercharge his healing. She had a stack of diet books. He simply wasn't getting enough nutrition to heal the ulcers. He didn't like the diet at all, by the way. At some point, you kind of have to stop being polite and just tell patients' family members bluntly that you don't have time for this crap and what you recommend, and they can do what they want and just document everything. It happens a lot, but she sticks out. We also had an elderly woman with severe malnutrition, and her hippie daughter wanted us to only give her raw, unpasteurized goat's milk. We did everything we could to convince her that her mother wasn't getting enough nutrition. We even tried to allow her to bring in the raw, unpasteurized goat's milk that we would supplement with the FDA-approved formula we wanted to give her mother through the feeding tube. We finally had to become pretty blunt with the daughter and let her know that her mother was going to expire due to malnutrition, due to the daughter's unique views on what was a proper diet for her mother. Story 5. A guy brings his wife to the ER. Her leg has a 7 by 7 centimeter wound from diabetic ulcer with lots of other fluids and larvae. Now I took one look at her and referred her to the surgery department for admission, but the hubby is adamant about his wife's kidney disease. But doc, it's just a wound. You have to fix her kidney first, doc. I read online that diabetes can cause kidney failure and you have to do something for that. I spent an hour convincing him that his wife would probably expire before the kidney damage set in from sepsis from the clearly infected wound. During my pediatric internship period, one day I was in charge of the general ward, basic things, look after the kids, solve small complaints, and evaluate new admissions. Now where I work, interns are supposed to draw blood from children for tests. So I went about my job, and there's one little tyke who's a bit too active and jumps around when he sees the needle. The mother gives me a vile look and says, "You lot are just puncturing my child for your education." At which point, the kid just screams even harder. Yes, I am studying to draw blood at 2 in the morning by waking up a kid. That's what she thought. It took a fair amount of convincing, too. Once, I took care of a child who got measles. The mother and father were strongly anti-vax but were yelling at me. How can modern medicine not have a treatment for measles? At which point I told her there was a preventive method, but you didn't use it. She asked me what it was, to which I replied, "Vaccinate your child." She said, "You're just one of them pharma lobbyists, aren't you?" Yes, I am a pharma lobbyist who wants to put the children's lives in danger by vaccinating them. Another time, a lady came screaming into the ER. She was all dressed up, and so were her 2 grown daughters. All of them were screaming hysterically that their mother was going to die. I went by them and nearly got tackled by the son-in-law, husband of one of the daughters. Save her. She's having an embolism. Shaken, I examined the lady and asked her where she was coming from. She apparently had a bit too much of potatoes. A shot of pantoprazole later, her embolism was gone. She had a bad case of fart embolisms. One thing I will never forget is how I learned never to be mad at a patient. Now, this was when I began as an intern. A patient had an intestinal obstruction. We inserted a nasal feeding tube, as the patient could not have anything orally before the surgery. The problem was that they would always come and complain to me about how I didn't stick it properly. After 2 or 3 such episodes where I reluctantly dressed it, they complained that the tube is out of the nose, and lo and behold, it is out. It's very uncomfortable. Most patients try to pull the nasal tube out. I replaced it like 4 times. The poor guy was fed up by then. On the morning of the surgery, his wife comes and asks me, "Doc, can you just remove that tube so that I can give him some coffee?" Now, I am totally mad. I was working a 72-hour shift, so I scolded her by saying that if she or he didn't want the surgery, then I couldn't do anything, and it would be nice if they gave me some peace. She didn't say anything. The patient, 50 years old with no other complications, expired on the table. I couldn't face her. The moral being, doctors know more things than patients, but it's not always wise to bite their heads off. I could have convinced her it was impossible to remove the tube before surgery in a calm way. Since then, I've tried to be a better speaker to patients. Story 6. My mother went to ridiculous lengths to deny that I had the disease. She just couldn't accept it. The doctor had to speak to me on the side because of it. My grandmother has Crohn's disease very, very badly. It skipped my mother and her brother. When I was 15, for over 6 months, I went from being 5'9" and 190 pounds to being 110. I was a skeleton, extremely anemic, and coughing up blood. My mother was convinced it was something else. I forced her to bring me to a doctor, and she spouted off all these possibilities. She then talked about what she Yahooed, not even Googled Yahoo. She talked about genetics and such, and how Crohn's can't skip generations. Well, the doc said, "Just in case, we're going to run some tests. Long story short, I have Crohn's in my throat and small intestine, so does my cousin. It just skipped a generation." Story 7. We had a 38-year-old female patient coming in for a routine eye exam. I asked her all the usual background health questions. I noticed she had marked migraines for 20 years on her health history form. Whenever anybody mentions they have headaches, I always ask for more details. She said she's had migraines every day since high school. I was a bit confused. I said, "Every day?" And she said, "Yep." I asked further about her diagnosis of these, and she said she's just seen regular family practice doctors and even a neurologist. I asked her to describe the headaches in detail, how long they are, where on the head, what time of day, etc. She got irritated with me and said, "Aren't we supposed to be doing a simple eye exam? These headaches don't have anything to do with my eyes. They are migraines." At that point, I stopped asking questions and silently hid my anger with her and just did the eye exam. Near the end of the exam, I noticed her optic nerves were swollen. I explained that swollen optic nerves require urgent referral for imaging of the brain. A CT or MRI needs to be done first, and other testing if there is nothing found. They came back clean. I ordered a lumbar puncture after that, and her cerebrospinal fluid pressure came back 3 times higher than normal. She was put on a medicine to bring it back to normal, and her unquestionable diagnosis of migraines that she had every day for 20 years was instantly cured. Story 8. I am a clinical pharmacist, and an ER physician once told me a case that I will never forget. A 16-year-old boy was presented to the ER with an extremely swollen, discolored privates. Apparently, he has been using his mom's insulin needles to draw blood out of his arm and inject it into his own package. He thought that adding blood would help increase the size. It was terribly infected, and he was hospitalized for a week or so. And one day in the pharmacy, a girl comes to the counter, requesting a refill for her birth control. We pulled up her profile and realized we couldn't refill it because she just got a 28-day fill less than 2 weeks ago. When we asked what happened to the other one, she said she was out. Apparently, both she and her boyfriend were taking a pill, and she was adamant that that was how they needed to prevent pregnancy. Story 9. Picture a middle-aged man. His index finger is 5 times the size of the rest of his fingers. It smells, it's leaking pus, and there's necrotic tissue. Basically, one huge infected cancerous finger. He was a firm believer in not taking any sort of medication, including antibiotics or chemo. He expired a few weeks later, but he did manage to tell us we were all idiots before he passed away. Another time, there was a young child who came in with an extremely high blood glucose level. Once she was stable, we did some teaching and kept her for a few days for observation. For some reason, every time I checked her, her levels would be extremely high, although we were appropriately treating her. Turns out her family would bring her fast food for every meal and hide it in the side table. More teaching and resources were put into place. Once, I had a mom in hysterics because she was convinced that her neighbor's friend's stepson's teacher's dog had MRSA, so her baby was going to die. It took everything within me not to tell her that most of the hospital staff have MRSA, but it took 3 hours for me to finally calm her down after I called infectious control, her pediatrician, gynecologist, and family doctor. Yes, I had to call all these people. Yes, they laughed at me, and yes, she was beside me the whole time questioning their judgment. I love my job, but at times it makes me crazy. Story 10. Sis, yes, I am a registered nurse, and I see some crazy stuff, but one thing that stands out was the time I was admitting a guy to the hospital. I can't really remember what for, but he was about 400 pounds, diabetic, had heart disease, you name it. Anyhow, I am at the computer going over some admission questions with him and his 10 family members who are crowded in the room with him. A few minutes in, he starts complaining that he's thirsty. He needs something to drink right now. So I got on my phone and called the nurse assistant and asked her to bring in some ice water. As soon as the words are out of my mouth, the whole family screams, "No, no water. He's allergic to water." Well, this is going to be a problem. Turns out the guy had been drinking nothing but Sprite and sweet tea for years because of his water allergy. The next question the wife had was, where are we all supposed to sleep? The whole family, 10 people, were planning to stay at the hospital with him. Story 11. My dad is an emergency nurse. He experiences the same thing doctors in the ER do, maybe more so because he's the one in the rooms more often. He once had a patient come in with several pages he printed off the internet. He kind of slammed them down and said, "This is what I have." He had bloating, nausea, vomiting, diarrhea, bloody stool, and fever, among other things. He insisted he had schistosomiasis. He was being a real jerk about it, like the medics were wasting time since he already knew what he had. So, my dad asked when he got back from Africa, and he said, "Africa? I've never been to Africa. What the heck would I be doing in Africa?" My dad then proceeded to tell him that schistosomiasis is a parasitic disease one gets while swimming in the Nile River or other rivers in developing countries like in Southeast Asia. He got pissed off because he thought my dad was being a know-it-all. He got seen and diagnosed with gastroenteritis. The bloody stool? He had hemorrhoids. Story 12. I am a med student, and on my pediatrics rotation, a mother refused vaccines for her kid after educating herself. When prompted as to what she was using as her source, she replied, "My own brain." Lovely. Maternal instinct is a popular anti-vax reasoning now. Terrifying on two levels. One, that people would actually consider themselves a better source of information than decades of research and results, and two, that they honestly don't realize how easily they are influenced by outside sources and really think their decision came from their own reasoning independently. Story 13. A friend of mine is in her last year of her medical career. She told us about a group of women they received, a very low social position, who had gotten pregnant and wanted to abort. Well, they somehow heard of this method where you make a paste out of smashed parsley and put it in your downtown area to abort. As it turns out, it actually works, but because parsley has this certain enzyme that mixed with other stuff causes severe cellular death and necrosis. Some passed away out of a necrotic hoo-ha, and some turned into a real-life Barbie, and not in a good way. Story 14. I recently had a 30-year-old insulin-dependent male argue that he knows when to take his sugar medicine. He had bilateral retinopathy and a severe vitreous hemorrhage in one eye, legally blind, driving a car, last eye check was 8 years ago. Lost glasses 2 years ago, and will need 4 or more surgeries, including an inevitable cataract. I had a patient tell me they clean their contact lenses with milk because it gets the acid off them. I had a patient ask me if it was okay to look briefly at the sun for short periods of time to improve their eyes. I was amazed and kindly suggested they not. Also, had a patient put eardrops in one eye. The white part of the eye scarred over the entire cornea, and it was left with no light perception. He asked me if he should have come in sooner. It had been 4 months. He needs a cornea transplant, which sucks and takes over a year to recover from. A patient with a retinal detachment told me to put more medicine in their glasses to see better. Macula was off, so they could barely count fingers 4 feet in front of their face. I once had a patient wear contacts designed for 2-week daily wear leave-in for 8 months. They literally grew into and became a part of the eye. It was repulsive. And one patient with a 6-year-old translating. Basically no clue, besides my eye hurts. Her hand was covering her eye. I asked to see the problem. Her eyes looked like a shriveled-up grape. The optic nerve was holding onto a shriveled-up, decayed eye loosely hanging in the orbit. She wanted glasses. Had a lady put jock itch in her eye to cure her suspected fungus. I asked her why she thought it was a fungal infection, and she just had an inkling. Cataracts in a 58-year-old male working on rooftops for 30 years with no sunglasses. The best corrected vision was counting fingers at 6 feet with one eye, barely seeing better with the other. First eye exam, and he was mad when I told him he needs surgery and should not drive a car. Had a patient tell me the benefits of using alcohol wipes to clean her genitals out of the blue. I am an eye doctor. Had a guy clean his contacts in the shower with shampoo because he was convinced it was better. He had a raging red eye 2 weeks later. Homemade contact solutions are always fun to hear. Vinegar? Salt water? Spit is not cleaner than a fresh solution. But please tell me more. A guy recently came in because wife made me, tried with tweezers to remove metal from the cornea. It didn't look pretty. I removed the remaining metal rust with a needle and a spinning burr tip brush, asked him to take antibiotics every 2 hours, and told him not to do that again. I once had a patient crush a pill and put it in their eyes. It was an eye vitamin but taken by mouth. Her eyes were angry. I had a patient walk in one day with no glasses or contacts. Had full penetrating cornea transplants in both eyes 17 years ago. The last eye exam was 12 years ago. He swore he could see fine, clearly a transplant graft rejection. One eye with no functional vision, and the other was a gnarly-looking good eye. I barely got him seeing with glasses on one eye, and he can't drive. Uncontrolled diabetes, too. I have had more than one patient argue with me about not seeing right. They either had 2 or more contacts in their eyes or none at all. When they try to remove a contact that is not there, it causes a painful abrasion. Multiple women are using non-approved glues to glue on fake eyelashes. Leaks and burns in the eyes. Just why? Using fake contacts from the nail salon. Then it never ceases to amaze me when I hear, I just use the same solution until it turns brown or black every day. I had a patient using a homeopathic drop to cure itchy eyes. She had pubic lice living on her lashes, and they lay eggs and bite. Repulsive. But she was still convinced the drops caused the lice. You pluck the offending lashes out and use a cream to kill the crap you can't see. Thank God that was only once. I have to convince a lot of people not to use hand sanitizer in their eyes. Way too many, actually. I had a patient not taking her herpetic eye drops because she just wanted to pray instead. Yes, herpes on the eye. Luckily, I convinced her to do both medicine and prayer. Story 15. I am a dental student. One patient in particular is a pathological liar. During one visit, they claimed to have gone to medical school. The next visit was to the dental army. The last visit was when they had a PhD. The patient will say things like, "Hey doc, do you need me to move my head mesial or distal? No, I need you to move your head right. Hey doc, are these cavities being caused by the anaerobic pathology microbes? No, they are caused by you eating snacks all day and not brushing." I am an OR nurse, and I had an oral surgery patient who had a self-reported history of more than 250 various surgical procedures, a list of 20-some allergies, tons of reported health issues, plus her preteen son supposedly had dozens of health issues as well. She refused to remove her glasses during induction, started screaming and crying about claustrophobia when we put the mask on her face. She also insisted on taking a stuffed animal to the OR. Anyway, getting to the point, she was having oral surgery because she told us, insisted, that the last time she went to the dentist, they told her not to brush her teeth for at least a year. So she hadn't brushed her teeth in like a year and a half. That was one for the books. Story 16. I am a registered nurse who works with oncology patients, some of whom are on clinical trials. I got a patient, and before starting his chemotherapy, reviewed some of his lab work with him. I told him his glucose level was 73. The normal range is usually between 70 and 100. He got really upset at this point and asked him, "What's wrong? Your labs are within range." And he said, "I need it to be 0. I said, "What? Why would you want your glucose to be 0? He said he's trying to meet requirements for a new clinical trial that requires his glucose to be 0. I told him, "I don't know what clinical trial you're trying to get into, but if your blood glucose were 0, you'd be dead or dying." He was not convinced because I am just a nurse, so I sent a message to his MD asking them to educate their patients better. Story 17. I work in the ER. We had a very pregnant patient come in needing stitches in her downtown area. Turns out she was a realtor and didn't want her water to break while she was showing a house, so she put a glass cup in her pants to catch the water. Instead of using a pad or an adult diaper, she went for a glass cup. She sat down while showing a house, and sure enough, it broke and cut her up pretty bad. Story 18. I was treating cavities on a very nervous 4-year-old. I had finally gotten into a cooperative groove when the genius mother looked up from her phone and noticed that I was drilling teeth. She was in the room the whole time. I had reviewed treatment with her. She knew we were fixing cavities. She then proceeds to curse me out under her breath saying, "You're drilling holes in her teeth. This is ridiculous. You people are scammers making holes in people's teeth." I kept my calm and said, "Ma'am, if you have questions, I will be happy to answer after I am finished." I am shaking with rage at this point because she was 20 minutes late to her appointment, and I am bending over backwards to make sure her kid has a good visit and doesn't end up scared of the dentist. The appointment is over. The kid jumps down, high-fives, and gives me a big hug, and I turn to Mom and ask her how exactly she thought the cavities were fixed. She said, "You don't drill. My mother is a dental assistant." I then proceeded to explain in excruciating detail the scientific process of how we remove decay. She said, "That's not true." I then told her that she can go ask her mom, ask Google, or go to dental school if she wants to know more, but I won't be treating her child anymore. Story 19. I am an optician. We had a patient who refused to let us use the tonometer, a machine for checking ocular internal pressure to diagnose glaucoma. He said that the puff machine gives you glaucoma, and we were going to pull that on him. He told us his father had an exam and had glaucoma after using that machine. His uncle and brother also had no signs of glaucoma, and after getting the puff test, both people were diagnosed with the disease. Glaucoma doesn't have any outward symptoms before you start going blind. This jerk just told me he has a very strong familial disposition to glaucoma and refused to be tested for it. Also, puff isn't that bad. Try contacts. Your eyes stop fighting back pretty quickly. The puff is a lot better than the old machine. It just hits you on the eyeball with a little ball on a lever. I also have plenty of patients who don't understand family history. I interview patients directly so we don't have any real paperwork, and too many people can answer simple questions. Do you or any of your direct family members have diabetes? Yes. Yourself or your family? They're never clear. Alternatively, if yes to family members, they start listing their spouse's family or stepchildren. That's not how genetic disposition works. Or after getting no answers to diabetes, hypertension, glaucoma, thyroid problems, heart problems, etc., I ask if they take any medications. Yeah, atorvastatin, thyroidazine, metformin, and low-dose aspirin. Oh, so you have everything I asked about. Check. Way too many people don't understand presbyopia. As you age, your lens hardens and can't focus up close anymore. Of course, when this is explained, I get a lot of people who believe they're way too young for bifocals. No, 60 is not too young for bifocals. Why doesn't the doctor have to wear bifocals? He does. He's wearing progressives. You don't see the line. Or after trying to get used to multifocal lenses for a few days, giving up and demanding we remake them as single vision, and then getting mad at me again when they can't read with them. I never needed bifocals before. Why can't you just make me regular glasses? Regular glasses always worked just fine. Yeah, you used to be 20. Also, you came to see us because you can't read with your regular glasses. In the same vein, these same people are complaining about their own insurance to me because progressives are expensive. A lined bifocal is covered entirely. Progressives cost a lot. I can't have lines in my glasses like an old person. Then you want progressives. This easily triples the bill. You need a bifocal. You don't need a progressive. You want a progressive. Insurance pays for what you need, not want. I actually had a guy make me talk to his insurance agent about him needing medically necessary progressives. A progressive lens is never medically necessary. In my mind, I am always like, stop being cheap and listen to what I say. I am not a salesman. I am a medical professional. Stop acting like you know better than me. We've had a patient with cataracts tell us the optometrist was incompetent. She couldn't possibly have cataracts because she doesn't have cats. There was also the patient with 6 by 120 red of any 6 by 60 LE, and binocular viz told us we were lying and just trying to sell him glasses. We weren't. It was a government-mandated acuity test, and we aren't permitted to make sales off them. His logic was, he hasn't been for an eyesight test in 17 years, so there's no way he needs glasses. He got back into his car and drove off. We've never sent paperwork back to the authorities so quickly. Story 20. I had a young woman with recurring UTIs that began after a recent partner and with no set Ds went through the standard questions trying to figure out what could be causing them and eventually found out she had been lubricated with jelly. Not KY jelly, but actually food jelly. The mix-up had literally been a joke on house. It took me some effort to keep a straight face, but we eventually resolved the problem and she stopped getting UTIs. Story 21. I am a nurse who worked in the OR at a trauma center. I was once doing surgery on a 19-year-old who tested positive for powder in his system and who was grilling the anesthesiologist about every drug we were going to use in surgery because he doesn't like putting chemicals in his body. Gotta stick with that organic, fair trade, non-GMO powder. One day, a guy was trespassing in a junkyard and got his arms and legs screwed up by a pit bull. I had to clean out all these wounds. Flash forward to 3 a.m. that night, I got called in to do a case. Apparently, the guy left the hospital AMA to get revenge on the dog, and the dog bit him in the face, breaking some facial bones and poking a few more holes in the process. Story 22. I am a medical technologist, and there are plenty of moments, but this one sticks out. I did a finger stick for a patient, ensured the little cut stopped bleeding, and then put a Band-Aid on it. I then told her to collect a urine sample for testing. The test came back strongly positive for blood. She complained to the doctor that there is no way she has blood in her urine and that the blood from her finger stick must have entered the urine, throwing off her reading. She said it was my fault that I did her blood test before her urine test, and I obviously made a mistake. She repeated the test later in the afternoon, still at 4+, came back a week later, still at 4+. The look on her face when I told her, "Sorry, ma'am, your result is still positive," was priceless. Story 23. My aunt, who has varicose veins and is pretty obvious to anyone who sees them, once asked me why her legs hurt and what those bluish lines under her skin were. I almost went on to explain to her about dilated veins when she interrupts and decides for herself that those are her nerves, dying nerves. And the blue stuff was blood clots inside the nerves. I am a med student. Also, one time I was doing a respiratory system examination on this guy who frequently gets admitted to the general ward with complaints of breathlessness. He's had COPD for a couple of years. That was quite bad. And he tells me that he isn't going to quit smoking because God told him not to. When asked why, he tells me that the people who are relying on him for their daily livelihood won't survive if he stops. I went on to ask him if he meant the people at the cigarette factory or the health industry. He didn't get the sarcasm, though. Story 24. I was working at a clinic. I was speaking with a non-controlled diabetic patient about her sugar intake, and she said she drinks a 32-ounce soda every day. I ask her if it's regular or diet, and she replies with, "It's half regular. I let the ice melt first so there isn't as much sugar in it." Sorry, but that isn't how it works. I have had several arguments with diabetics about Coke/Kool-Aid/sweet tea versus those made with artificial sugar. I tell them, look, don't drink sugar. If you have to have something like that, use an artificial sweetener. And they are always like, no way. That stuff is poison. It will kill me. Ma'am, your A1C is 14. Sugar is already killing you. Story 25. I have a friend who is a doctor on the children's ward in a rural hospital. These parents bring in their child, whose hair is infested with lice. The louse was visible to the naked eye and could be seen crawling on the child's clothing. While the medical staff examined the child in order to determine a course of action, they discovered the child was covered in a white powder and smelled heavily of chemicals. They asked the parents what the substances and the smells emanating from the child were. The parents said, quite matter-of-factly, that it was 7 powder and flea and tick spray they used on their dogs on the family's farm. Needless to say, social workers were notified about this case. I had a neighbor in rural TN who was convinced that the best way to treat her child's head lice was to comb diesel fuel through it, and that doing it in an enclosed living room while smoking cigarettes was acceptable. She was baffled when CPS took her kid away. Story 26. I am an optician, and at this point, I was a young lady in my mid-20s. I had a guy come in saying he was a doctor, and he wrote himself an RX for glasses, and he brought frames. A few days later, his lenses come back. He puts on his glasses, and he can't see. I start going through the possibilities. Usually, with progressive lenses, it's an adjustment issue, and they need to sit differently on his face. He completely refuses to let me adjust them. So I checked the lenses, and the RX matches what he wrote. I tried to explain that there are only 2 options. Either they need to sit differently on his face, or the RX isn't good. He tells me, "You don't understand. I've had eye surgery for a disease that you've never heard of." I offer to remake his lenses to prove a point. His new lenses will come in a few days. An older coworker is helping him. I told her everything. Again, he can't see, she tells him. The young girl who tried to help you last time was trying to explain that if we adjust your glasses, you might be able to see out of them. Will you please let me try? He lets her, and suddenly he can see. Turns out the jerk was a lung doctor, and not even an eye doctor. Story 27. I was a unit secretary and nurse aide on a radiation oncology unit in the early 2000s. We had a patient show up through the ER and be admitted for emergency radiation treatment. She had a massive fungating mass in her mouth that had consumed half her head. When the rad-onc doc tried to examine her and open her mouth, her remaining teeth fell out into his hand. It had eaten through the bones of her face, invaded her eye socket, everything. The doctor said it was the worst case of mouth cancer he'd seen. According to her husband, she had a small lesion on her hard palate, and upon receiving the diagnosis of an early-stage squamous cell carcinoma, she decided to treat it with essential oils and things like frankincense because chemo was poisonous. Her husband said he had tried to reason with her, but she was adamant about the natural treatment. She passed away in agony shortly after. Story 28. As an ENT, I once received a weekend call from a patient who completely caught me off guard. I answered, "Yeah, this is the doctor with ENT," expecting a typical follow-up or sinus issue. Instead, a guy on the other end said, well, my sacs really hurt." Thinking it was some kind of prank, I reminded him, "I am an ear, nose, and throat surgeon." He replied, "Yeah, I know. I am being treated for a chronic cough." Confused but curious, I asked what the connection was. He continued, "Well, you know how when you go to the doctor and they put their finger down there and tell you to turn your head and cough?" I said, "Yeah, they're checking for a hernia." Then came the kicker. "So do you think my coughing is why they hurt?" I paused and said, "No." He asked again, "Are you sure?" I finally asked, "How bad do they hurt?" He replied, "I can't even put on my underwear." At that point, I told him, "Go to the ER, dude," and ended the most bizarre ENT-related call I've ever had. Story 29. I am still just a medical student, but our hospital sees a lot of poor and poorly educated patients since we're a big tertiary hospital in a developing country. The worst I've seen so far are the old ladies who everyone in the family turns to for health advice, their only qualification being seniority. They usually have a bunch of superstitions that end up contributing to the patient's condition in the first place. I once saw a neonate brought to the ER for a really bad oral infection, and the mother clearly hadn't taken a bath since the delivery, as it's a common superstition here that mothers shouldn't take a bath a week or so postpartum, so we figured that's the source of the infection. While we're assessing the patient, the doting grandmother in the background decides she has to comment on everything we're doing. Remember, she's probably the one who advised her daughter not to take a bath. I just had to shut her down because it was late and people were running out of patients in our understaffed, under-equipped ER. They're more worried that pulse oximetry is hurting the baby's tiny whittle toes when there's freaking pus leaking out of the baby's very inflamed salivary glands. I mean, I get that infections like these are a disease of poverty, that their poor education is just indicative of a wider systemic problem that Philippine society fails to address time and again, but by golly does it get annoying. Story 30. I am a physical therapist, and I love the macho Hulkians who come in for shoulder pain with giant pecs and arms. No back muscles. I hand them our pink 1-pound weights, and they laugh and think I am an idiot. I make them lie down on their chest for 1 minute with the weights. They want to cry because it's so hard. My mother most likely has an undiagnosed hypermobility syndrome. She's 65 years old and can still easily touch the floor with her hands while standing straight, which isn't typical at her age. She also has off and on back pain. With hypermobility and pain, the focus should be on improving joint stability and strength through targeted exercises. I try to guide her on what exercises to do, but her go-to solution is to stretch even more for a condition that already involves too much flexibility. Hypermobility is fine, as long as it isn't resulting in pain. Backs are hard to diagnose until I can do an in-person eval. There are a ton of muscles that help stabilize the back, and there are a lot of ways to screw them up. Story 31. My mom once had to try to explain to a doctor that, regardless of tests, she has celiac because Google said that if you have celiac, you get sick when eating bread. She just wouldn't accept that as you get older, you can eat half a loaf of bread in one sitting. I have never seen a doctor want to off themselves more. By the way, I am not talking about ham, lettuce, and tomato sandwiches. I am talking about a slice of bread, a thin spread, and another slice of bread with a person who is addicted to drugs. Where I live, the loaves are normally 520 to 600 grams. Giving it the higher end because I am lazy means she has been eating 300 grams of bread maximum each time. It really is not a crazy amount. A lot, yes, but not crazy amounts. Story 32. The patient had a hard time getting pregnant. Finally conceived, but miscarried. The patient has a D and C, so she can try again. This time, with medical intervention, we monitor her blood to ensure the pregnancy hormone is gone before beginning treatment. But she keeps coming back with high levels of hormones. The docs are worried because she might have some retained placenta or pituitary disorder, and this could be super bad for future fertility. We call her in for a conversation about the hormone levels not going away. After talking together about what might be wrong, they are going to go home and think about further tests. She says, "I need to go. I have an appointment at the weight loss center for an HCG shot." Turns out that she is on the HCG diet. HCG is the pregnancy hormone. And this was after an hour of the doc saying, "We don't know why you have these constant high levels of HCG in your blood, and we are worried." Story 33. I am a gastro nurse, and we had a recurring patient who was just a really very strange lady. She had a stoma that absolutely stunk to high heavens because for the last 20 years she has not been cleaning it properly. Every single day her stoma would come off because she was twisting the drain tube and wouldn't allow us to change it. So, this lady was really rude and would shout at us too, and one night shift, I couldn't take it anymore and I snapped at her. I didn't yell, but I was overly stern about the fact that if she did not let me clean and treat her stoma, then the MR say that she wasn't able to get rid of because she refused hibiscrub washes would eat her alive. In hindsight, I didn't handle that very well, but she let me change the stoma. So this entire ordeal, she's yelling at me that her stoma bags are not cut to fit her stoma, that they are too small because her stoma is 50 by 50 centimeters, to which I corrected her saying that's impossible. She was adamant that's how big her stoma was. When I was cleaning the stoma, she yelled at me because it was hurting, so she wanted to just pop the new one on. I explained it was hurting because of an infection, as she never cleans it. She proceeds to tell me that she knows better because she has had the stoma for nearly as long as I've been alive. I eventually ended up telling her to shut up and let me do my job, which seemed to work, and the stoma did not come off again that shift. She refused every placement to the point where we almost considered a court order to evict her. When she was eventually discharged, one of our foul one sets nearly cried with relief. Story 34. A while back, I helped open an urgent care for the first 2 years. When we first opened the doors, one of our first customers was an 85-year-old, adorable Asian lady who was really hard to understand but talked a lot. Anyway, this lady came in for the first time complaining of stomach pain, and we attempted to diagnose her with something, but nothing added up for about 30 minutes to an hour of her talking until she finally told us she just felt better. Okay, so we don't really mind it until next week. Around the same time she shows up again with the same problem. And guess what the solution was? About 45 minutes of listening to what she ate for dinner the last few nights. I think we eventually figured out corn was messing with her, but this never deterred her from coming in more. This eventually became a once-a-week occurrence, then a once-every-day thing, until we finally started becoming a busy urgent care, and we couldn't really fit her inside our schedule. I swear this lady actually came in every day thinking she was on the verge of passing away until we had convinced her she was fine. In case you're wondering, I am almost certain she's well over 90 now and still going. Thank you for watching. If you enjoyed this video, be sure to give it a thumbs up, subscribe, and hit the bell icon so you never miss an update.